was about a month ago that Hartford Healthcare saw a change in leadership when Jeffrey Flaks took over as CEO for Elliot Joseph.
And he's joining us right now to talk about his plans for the organization and the hospitals that it runs across the state. Obviously, a lot to talk about. First, welcome. Hope this is the first of many visits.
Thank you.
How's the first month been so far?
It's been great. It's been great. You know, I've had the benefit, the pleasure, the honor, really, of being 15 years at Hartford Healthcare. So it's a great moment, and it's really been a fabulous transition.
And it has been a time of tremendous growth for Hartford Healthcare over those 15 years. I imagine it started with just its hospitals, but now it's about a lot more than different hospitals. And I see that Hartford Healthcare bills itself as truly integrated.
Correct.
And just for people at home, though, that sounds kind of buzzwordy. What does that mean? What does that mean for them?
We've built really a system of care. And to me, this has never been a better time in healthcare than this moment. The emergence of really what took more than a decade to create, which is the integration of urgent care, primary care, specialty care, behavioral health, ambulatory surgery, community-based radiology services, all of these different capabilities that are now coming together. We're organizing them around the patient, and we're really creating an opportunity to provide a level of service, a level of care that's never been better than it is right now.
Not just yesterday, we saw how important having the trauma centers, the critical care centers, prepared and ready. Obviously, we saw that yesterday with the response from the plane crash.
First of all, my hearts go out to everyone who was impacted and the families in this circumstance, such a tragic set of circumstances. At the same time, though, you do see the centrality of what a hospital means, what our physicians, what our nurses, the way the care delivery system comes together. When we activated the trauma service yesterday, it was like watching a symphony. I mean, there were people working against so many different levels, from the emergency department to the operating rooms to interventional services, all organized around responding and partnering with the first responders. I mean, one of the images I saw almost immediately was watching our helicopter, Lifestar, hovering over the scene. And you just realize the essential role that our team plays, and it's why we're there, and it really reminds us of our mission and our purpose.
Yeah, that is a good point. You know, it started with Lifestar and then proceeded to Hartford Hospital itself.
Correct.
But then at some point, the doctors were saying we're taking some of these people down to Bridgeport to the burn unit there, and Hartford Healthcare has been involved with that every step of the way. How is it making it easier, or that integration for these people, as opposed to if it was just being owned by 3 different entities?
Sure. So we're now in Fairfield County with St. Vincent's Hospital, which we're very excited about. And to me, it's about our vision. Our vision is to be most trusted for personalized, coordinated care. And what that means, what it really means to the people we care for, is that we have patient navigation, health coaches. We have a system from electronic health record to every person who touches that patient. It's one team, it's one level of care, one standard of excellence. So it's really, we're really able now to demonstrate value in people who experience it. When I experience it with my own family, I'm amazed at how the system's organized around us, as me as the patient.
So you're saying it's just the communication is leading to efficiency, which presumably would lower costs.
Yeah, it's about excellence, it's about quality, it's about safety, and it's about efficiency. So the nature of having all of these services coordinated and integrated really does make a difference.
And I have to imagine from the patient's perspective, that makes what is such a scary, terrifying situation just a little bit easier.
The advances are amazing. I'll tell you, 10, 12 years ago, when we would have a patient at our hospital in Meriden at Midstate, and we would transfer that patient to Hartford Hospital for an advanced level of care, we used to wrap with saran wrap their medical record around them and images, if they had a CAT scan, a disc.
Really?
Today, fast forward, that information is traveling through the cloud before they ever get there. There's people coordinated, talking. They have all their historical information in front of them. So it is much safer, much higher quality. Healthcare's never been better than it is right now. In 3 to 5 years from now, it's going to be significantly better than it is today.
And 15 years ago, I imagine it was just Hartford Hospital and Midstate, and now look at it. It's not just the hospitals. It's all the different community-based centers and whatnot. It's the nature of things have changed, and you guys seem like you're on top of it.
We have 370 locations in Connecticut. We're also in Rhode Island and Western Massachusetts. But today we have nearly 30,000 people who work with us. And the people who work with us do amazing work. They create miracles. And it's incredible to see the way the system has evolved to treat the people of Connecticut with world-class health care.
I think that just makes all of us feel that much better and that much more proud to be here and have you here in Connecticut.
Yeah,
thank you.
So much.
My pleasure. Thank you.
We do appreciate it.
Thank you.
Thank you.
All right, 9:22. Let's get you a quick check on the forecast. Matt Scott's been standing by. What do we got going on?
Hey, well, don't listen before you see these numbers and scream. These are the temperature changes over the last 24 hours.